watching it in Europe, right? It spread from China to Europe, and then the West Coast, and then it became kind of inevitable that we needed to be prepared for this in a different way than we normally run our hospital. And you know, as we were talking about going into what we've trained for, which is incident command structure that we're going to talk about in this segment, is just a completely different way of operating the hospital than we normally do in terms of roles and hierarchy and structure, and so it's we had so much coming at us that we knew that it was time to pull that lever and to go into incident command.
Yeah, absolutely. And one key point that I really cannot think about any more positively was just the teamwork that happened during incident command, because sometimes it was minute by minute decisions, hour by hour, day by day, being able to create that communication that was so key and important, not only to our employees, our families, but our community, because we were all adapting pretty rapidly in that space. And oh, by the way, we had really sick patients we needed to take care of that were COVID positive.
Yeah, we didn't know how long we would be in that room, but I agree with you about the teamwork and the communication that came out of that, just being in that one room together with those defined roles. And in this segment, you're going to learn a lot more about how that functions and what that meant to the hospital.
Incident command, interestingly, is a national management system of a crisis or an emergency. It began back in the 70s. It was created by the fire services. It was refined to be more of an all-hazard back, I want to say, shortly after 9/11. And as we're going into Katrina in 2005.
When you move into incident command, all of that sort of stops. Whatever your day job is, whatever you used to do ceases, and your focus is on the incident that you are managing. And you start transitioning from months to really hours in some cases, and then days, and as the incident goes on, that can extend, but it's operational periods. So basically, you stop living from how do I meet my goals for the year to how do I meet my goals by noon? How do I meet my goals for this 24-hour period?
You always start out with a command structure. In your command structure, you have your incident commanders who are responsible for the overall management of the entire incident. You have the safety officer, the liaison officer, and you may have technical specialists within the command that provide guidance to the incident commanders. For instance, during the pandemic, we had, it was obviously a heavily complex incident towards medical, so we had a lot of medical technical specialists providing us with information there. And then there's operations, which is the doers. They're the action people.
You move into a room that is designated as your command center. And all you as a section chief, which I was, the incident commanders and other key folks basically camp in that room. So that room became my home for what we determined was approximately 41 operational periods, which translated into about 50 to 55 days.
It's very interesting being in the room, and you definitely do feel like you're on the pulse of what's going on in the organization. And the way it was set up, there were different people that would be in charge of certain segments. The ones that were mobile, like the clinical areas, there would be different people that would come in either a weekly or bi-weekly basis. So you got a chance to experience everyone's style and also all the new ideas. One of the things that was interesting was how cohesive it was, though. People really were working toward a common goal.
I was asked to join Incident Command right around middle of March when that happened, and help with the Collins-Purley overflow site, which was established sometime in middle of March. It's a fixed structure. You have these fixed people that kind of, all come together to solve a common goal, but at the same time, it's pretty dynamic in that there are things moving all the time, and people coming together, meeting multiple times a day, bringing in what they know, and then going about doing what it is that whatever the goal was for that day, and then bringing that information back.
I thought we did a really bang-up job managing the incident by objectives. So objectives allow you to take a bite, and that's part of incident command, taking a bite of the elephant at a time.
Incident commanders were excellent, and just really were very task focused and action item focused, and were able to give us deadlines that were realistic but quick. So people were able to do their work and feel like they were accomplishing stuff.
And there always is that point where the request for resources outstrips your actual resources. And by slowing things down and managing it by objectives, you're able to even that up, and eventually it drops off, and now you have more resources than you need.
During incident command, you just felt an immediate response and immediate support, and if there were things that were needed, you knew it was going to get done. So everybody had the same level of urgency.
I think that's one of the major themes of this whole, incident command process is, there isn't time to like roll around in the problem. You have to actually attack the problem and come up with a solution. And it's your best solution at the time. And you have to be flexible enough to realize as more information comes, you alternate to a different plan.